Hello, everybody. We're going to pick up from where we left off the other day. We'll talk about some common methods of sterilization. You have high temperature steam, ethylene oxide gas, also called ETO, plasma sterilization, which is your STERRAD machine, also called hydrogen peroxide gas plasma sterilization. Parasitic acid processing, dry heat, and ionizing radiation. There are some considerations for sterilization. The speed of which you need this back would be one. What the instrument or device is made up of is another, because not everything can go into steam, which steam is obviously the fastest and the most economical, because all it uses is water, so there's no expensive chemicals. But not everything can be steam processed. But inevitably, it has to come down to whatever the manufacturer recommends that you use to process their devices. Process related parameters, you have time, obvious, how long you're going to put it in the process, saturation and surface exposure, the temperature to which the items are exposed, and the quality of sterilant, air and water. If there is residue of water left in a tray, it can completely throw things off. Everything should be dry. Just like a steam sterilizer, it automatically has the ratio set up. So if you have water left in a basin, it's going to throw that ratio off. If you have water in something and you put it in ethylene oxide, that makes that ethylene oxide become toxic. Well, I mean, it's already toxic, but I mean, like really bad. So you have to follow the guidelines for the product and the guidelines from the manufacturer of the product. And you also have to make sure that they're packaged in the correct packaging material. Quality assurance, you have mechanical. That's a little device within the sterilization unit. Things that you're going to be more familiar with will be the chemical indicators. Those are the little paper strips that come inside of your pill packs or your caskets that'll have the black line that go across them that shows that it has been exposed to the sterilant. Biological indicators, I touched on that the last video. Those are the ones that give a more accurate reading of sterility. And then you have what's called a DART, which is a daily air removal test. And that basically monitors the efficiency of the air removal of a high vacuum steam sterilizer. Now, going back on that briefly, there are some things that can cause failure of things to sterilize properly. One would be packing too many things within the sterilizer to where they don't have enough space between each item for the steam or chemical, whatever it may be, to thoroughly surround each item that's in the sterilizer. Or you may have them packaged too closely to the exterior walls or interior walls. I'm not sure how you want to say that. The walls of the machine, to where they can't get around the items that you're trying to sterilize. those can cause issues. So never overload, and always make sure you have enough space. The bacteria that is used for the biological indicators. These are some 50-cent words. I don't know if you've ever heard anybody say that or not. That it's like, can I buy a vowel when I say these words? But the one you all really need to worry about and that you'll hear about is the one for the steam sterilization, and it is really the main bacteria that is kept inside of one of the little biological indicators. And that little bug that's kept in there that you try to kill is called a Geobacillus staurothemophilus. Can everybody say that with me? Geobacillus staurothemophilus. That's what that little critter is called. And you're going to try to kill it. You kill that little bug in there, then you know you've got sterility. High temperature steam is basically what it sounds like. High and hot. You use that for a lot of the basic instruments and your cloths. If you have any kind of towels and things like that that get reprocessed, laundered and sterilized, you'll put those in the steam sterilizer. And you always put any cloth items being sterilized on the top, and then the caskets and things on the bottom, because you don't want, if there's any dripping, you don't want the drips to go down and land on the cloth and linen materials and absorb it, and then it won't dry properly. So anything cloth always goes on the top. You have a gravity displacement sterilizer. That is when the air is pushed from the inner chamber and the items get exposed to steam under pressure. That's basically like a great big pressure cooker. I don't know if you've ever had your grandmother cook under a pressure cooker. The big pot, and it's got the little valve on the top that always whistles. So basically what it does is it creates all of this steam inside of it, and it has a valve, and as the steam creates within, it pushes the air out of that little valve. It's a one-way valve, and it pushes the air out, and then there's left with nothing but steam, hot steam circulating within the device, and it sterilizes. That's the gravity displacement. Dynamic air removal, that's a pre-vacuum. Then you have your flash sterilizer. That's also called an immediate use steam sterilizer. Those are the ones that are usually kept right next to the OR in case you need something really quickly. Sometimes they call it a one tray too. I've heard them call it that. They say, can you one tray this for me? That's when you need something really quick and you don't have time for it to go through the entire processing like you would a normal tray that you don't need right back. So they'll take it, decontam just like they would anything, but instead of running it through a big load with everything else, they bring it to the flash sterilizer and put it in its specific tray and process it right there for immediate use. Oh, and going along with that, when you do flash sterilize something, you have to keep a log. You need to know the time, date, obviously, the patient, what it was that you flashed, and the sterilizer will print out a graph, what am I trying to say? A report of if all the parameters were met, and you need to log that the parameters were met. That way, if something were to come back and the patient were to develop an infection, they can come back and look at that log and look at the report and see that nothing out of the ordinary had happened. Let's see. Water converts to steam at 212 degrees Fahrenheit, and steam must contain more than 97% water. Who knew, right? Okay, this goes back and touches a little bit on what I talked about placing instruments in the sterilizer. Place instrument pans flat on the shelf. Linen packs should be on their side, but at the top. Every item should be placed in there so that they do not touch each other. Remember, because you got to have that circulating around each item. Heavier packs should be placed at the periphery, meaning on the outer side, but not touching the outside. Any basins, jars, and cups would be placed on their sides. So that way if they were sitting kind of like this and then condensation would happen, it would drip inside of here, then it would retain moisture. You can't have that happen. So you lay them on their side so any dripping would run out. Any items with a smooth surface should be placed at the bottom. Okay, I told you about flash sterilizing. Ethylene oxide, that is used to sterilize items that cannot tolerate steam. They're more delicate instruments like your laparoscope. Oh gosh, I am so sorry. Basically anything that cannot stand the heat, and it is mostly cameras, light cords, and things like that that will go into the ethylene oxide. Ethylene oxide also has to be allowed to aerate because it is toxic. So it has to go through an aeration cycle. That just means allowing it to breathe and let the fumes dissipate. So if you are taking it from the ethylene oxide sterilant to the aerator, you have to pull it to that position rather than push it, because if you're pushing it, then the fumes are going to blow into your face, and that's toxic. Also, you have to wear a monitor on your badge that will show your exposure to the ethylene oxide, because it is toxic. And within an 8-hour work period, you are only allowed by OSHA to have exposure of 1 part per point. Let me get this right. 0.1 part per million exposure limit. Nothing above that. And with any kind of chemical, if you were to be exposed, you need to locate well, you should already know where your MSDS is to know how to handle that situation. Any items going into the ethylene oxide, basically any item going into anything needs to be wrapped loosely. I know when we're wrapping things, we like to get them all, with the blue wrappers, we like to get them all nice and tight and corners all creased. But technically, you need them a little bit loose, because if they're too tight, then that stuff's not going to, I feel like I keep using the word aerate, but it's not going to flow through as easily if the package is wrapped too tight. And there are different chemicals or chemical indicators for ethylene oxide versus, I'm sorry, for, yes, ethylene oxide and your steam. Gas plasma. That is your STERRAD. That's what you're going to hear it called, is the STERRAD. These are also for heat sensitive items. Gas plasma is a shorter cycle time than ethylene oxide, and the vapor is hydrogen peroxide, and it destroys the cell membrane and any kind of genetic material and cell enzymes.
How can we talk about acne if we never see it? Not in movies, not in acne ads. There are a lot more faces out there. Faces in progress.
Ozone sterilization, nobody uses that.
Let's try something new.
So I will just touch base with you on this. It's basically a form of oxygen that they use to sterilize with, converting it. I have yet to come across any facility that uses ozone,
Hey Google.
and I don't believe Mayo, which is a big hospital, I don't believe they even have it. So I don't really think that you're going to come in contact with that out there. And cobalt 60 radiation.
Roundup for Lawns is here to put unwelcome lawn weeds to rest. Roundup for Lawns is formulated to
Unless you go to work for a big company
in your grass. Roundup
somewhere where they're sterilizing their own packaging, like Johnson & Johnson or McKesson or someplace like that, you're probably never going to see a cobalt 60 radiation. This is a process of sterilization for most equipment available pre-packaged from the manufacturer, such as the sharps, sponges, sutures, and drapes. These are for items that are intended for single use only. So see, unless you go work for one of these companies, you're probably never going to see this. Let me look here and see. Yeah, we just got a few more slides left. I'll go ahead and go through them. This Creutzfeldt-Jakob disease. That one is a fatal disease caused by a prion. It's a protein particle. Most people do not even know that they have Creutzfeldt-Jakob until they are dying. It's a dormant disease that affects the neurological system. People develop stroke-like symptoms and end up in the hospital, and they just progressively get worse and worse. And the only way you can be diagnosed as truly having Creutzfeldt-Jakob disease is with a brain biopsy, and you can only get the brain biopsy after you're dead. So, yeah, you can only be diagnosed with it after you're dead. But, like I told my kids, for some reason we were talking about it the other day. That's just me. I talk to my kids about random things. But we were talking about Creutzfeldt-Jakob disease. And I was telling them, just like I'm going to tell you, the only way that it's even beneficial to know is if a relative, your mom or your dad or grandmother, grandfather died and they did a biopsy of their brain and you were told that they died of Creutzfeldt-Jakob disease. CJD, then you would know that you had a chance of inheriting this disease. Now, this also, there is a, God, why do I keep yawning? I apologize. I guess I'm still tired from vacation. There is another one called a variant Creutzfeldt-Jakob disease, and that's mad cow disease. That's the one people got from cows. It has the same symptoms. It's a neurological disorder, and it is also a prion, but it is not hereditary. If you catch it that way and it affects you, then it will not be passed down genetically. It hit mostly in the UK, not so much in the United States, and I haven't really heard about it since the 90s. I think it's kind of gone away. I mean, of course, the genetic Creutzfeldt-Jakob is still around. And if there is a patient that you work on, anyone works on, that has CJD, any instruments that come in contact with that patient have to be thrown away. There is not a sterilant around that can kill the bacteria of a prion. Oh, and it has to be reported to the CDC ASAP. FYI. So now, storage and sterilization. Storage of sterilization. Storage of sterilized goods. Sorry, I'll get it right. Time related is no longer. It used to be that some things had like a 30-day shelf life. They've done away with all of that. So basically now it's all just event related. If it gets a rip, basically if the wrapping gets compromised, then it's considered contaminated and you do away with it. If the casket, if the little locks get broken, whether you open the lid or not, if that lock gets broken, it's considered contaminated and you have to send it back to decontamination. Sterile items cannot be stored with non-sterile items. You do not keep them in the same place. It's ideal if you can keep like the pre-packaged items, your laps, I don't know it's hard for me to say because you all haven't learned all of these different types of things yet. Staplers, stapling devices, basically anything that are in pill packs from the manufacturer. If you can keep those behind closed cabinets, it's ideal. Not all facilities have the ability to do that, and they will keep them in bins. But if at all possible, they should be kept in a closed cabinet. And usually those closed cabinets have glass doors so you can see what's in there. They should also be kept in there loosely so you don't compromise the packaging. I've seen people try to shove as many of something as they can into a shelf so that they don't have to keep restocking. That's not the way you should do it. And you, just like with the instruments, you never put things that are heavy on top of things that are light. If you have something that you do not use that often, you can use a dust cover. That's basically just a little clear plastic cover, like what your back table covers, your packs come in, the little plastic. Commercially prepared and sterilized items may be considered sterile indefinitely. However, a lot of them do have expiration dates. If they have an expiration date, follow the expiration date. Some disinfection terms that we already talked. No, we talked about. So bactericidal is to kill bacteria. Virucidal kills viruses. Sporicidal kills spores. Fungicidal kills fungus. So I think you all might be getting the point that the suffix cidal means kill. Bactericidal kills bacteria. Virucidal kills virus. Sporicidal kills spores or destroys spores. Fungicidal kills fungus. Factors affecting disinfection would be the concentration of the solution. Obviously, the more it's diluted, the less effective it's going to be. The bioburden that is on the object. The heavier the bioburden, the harder it's going to be to clean. The water hardness on the object. If the water is too hard, it's harder to clean. Central Sterile uses water softening agents. I won't get into all that with you. And the presence or absence of organic material on the item can make a difference on the disinfection.
The first FDA-approved medication of its kind, Tremfya.
So with your disinfectants, they should be stored in a well-ventilated area. Wear your PPE when you are using them.
In another study, the majority of Tremfya patients
Dilute them as you are told to dilute them per the manufacturer. If it's a big gallon and it tells you this 1 gallon makes 500 quarts or whatever, you use the ratio that they give you to dilute it. Do not mix disinfectants. If you have one kind, do not mix it with another kind. I found out the hard way with my pool chemicals. One day I dang near set my grass on fire. That's a whole nother story. I'll talk to you about that whenever we get back to class. Turned my lawn brown. Whew. I'm glad I did it before I threw it into the pool, though. That would have been a nightmare. And make sure you dispose of the chemicals as you are told to. The EPA will be all over you. Environmental Protection Agency, you're flushing that stuff down the drain. And never use an unlabeled bottle or container. If you're taking something out of one container and putting it into another container because you're diluting it, whatever the main container says, the other container has to say it also. Commonly used disinfectants. Glutaraldehyde. Don't use it quite so much anymore. But it used to be used for a lot of scopes because it is a sporicidal, bactericidal, and virucidal. Tuberculocidal and in 20 minutes. Cidex. Items are placed in the solution for 12 minutes and then rinsed thoroughly. A lot of these things have gone to the wayside and we've just gone to the Sterad. HLD, high level disinfection, is just like it says. High level disinfection, not sterilization. It can kill most all organisms. Some spores, but not all. I'm sorry. I gotta put you on hold just a second. My son's calling me.